Okay, Mayor, let's see, is it going to be the judge first? Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and welcome to our Public Health District briefing for this afternoon. With me this afternoon is Mayor Joe McComb, Nueces County Judge Barbara Canales, and our Health Director, Annette Rodriguez. Our lineup today will be Mayor McComb will come up after I do these introductory comments, and he will talk to us about how we can get ready for Palm Sunday and Easter in terms of being mindful of and obeying the social distancing and the group orders. So he's going to give us some thought and some initial conversation on that this afternoon. He's also going to talk to us about the number to call if you see large groups of people congregating, whether at a park setting or throughout town. We want people to help us break those crowds up, so there's a number to call, and he'll talk to you about that. County Judge Barbara Canales continues to be a strong partner together with us, and she'll be talking to you more about the stay-at-home order that the county issued for the entire county. I'm going to provide the daily update on our COVID cases. I'll talk to you a little bit about our first responders who are in quarantine, and then talk to you and the community about some fire department operational changes, just so people are aware when they call, if they need to call an EMS, what that will look like going forward. And then Annette will provide an update on our statistics in terms of testing and some of the things we're doing there to make progress. So with that, we'll call up Mayor McComb first.
Good afternoon. We're inching closer to Easter, and I know folks are looking forward to that and hoping to have good family time, and I think you can have a wonderful time. It's a great time of the year, and despite the circumstances we're in now, we want to try to make it the best that you can have and suggest some things that will make that happen. Of course, this Sunday, April the 5th, will be Palm Sunday, and that begins kind of the celebration, and then the following Friday, Good Friday, and then, of course, Easter on the 12th. But what we want to do is to make sure that you and your family can celebrate in good health, and we want to remind you, I know you're hearing it over and over, but if you remember as a child, your mother probably told you things over and over and over again, because sometimes it takes a little while to get the message through, is that we practice our social distancing and to keep away from being exposed to the virus. And with 12 grandchildren and this, we're not wanting to put them in harm's way, and we expect and hope that our fellow citizens in the community will do the same and have respect for their families as well as yours in maintaining these minimal encounters in groups of 10 or less. Because the best way to stay healthy is obviously to not be exposed and catch this coronavirus. So we want to encourage you to stay in touch with your places of worship, find out what their schedules are, how you can participate in the worship services, either through the internet or telecommunications or however you do that. But remember, as my pastor says, the church is the people. Where you go and have a meeting, that's the building, but where the church is, that's where you are. And so, and it's a good time for fellowship and gathering, but at this point, I believe that, your health and safety of your family and the community really dictates, out of Christian concern and compassion, that you pay attention to the rules and try to protect yourself and your families. But churches are being very creative, and it's kind of interesting to see how outside the box some things can be made happening. For instance, yesterday they had a scavenger hunt via Zoom for the fifth graders at our church. And so they'd give them their order, and they'd have to run around their house and find something. And one of the main things they wanted them to find is see if they had a toilet paper roll. And then they had to find other things. And they just had a great time, and it was all through Zoom. And so I would encourage you to be creative, continue your worship. You can continue your prayer life and visiting with friends via text, via telephone, however. But remember to enjoy the holidays, because that's really what they're about, is to focus on what the holidays are about and enjoy your family and friends. If you need to, practice an Easter egg hunt this weekend, and then next weekend you could have the real thing. As long as you got fresh eggs, don't let them sit there a week. But anyway, there's a lot of things we can do as a community. I've mentioned before, but I can't tell you the number of good people that are doing great things in our community. And many of them you'll never see or never hear about, but they get filtered into us on a regular basis, and we've got some good folks. And we're just asking you to be patient with us and to help us work this thing, because the more committed we are to following the rules, the quicker these stay-at-home orders and this situation will come to an end. As long as we violate them and keep exposing and catching, then that just extends it. So if we're working together, we can make ourselves a whole lot better. And for those that just have a mindset that they don't care about the rules and somebody else wants to make sure they understand the rules, if you see a group that's congregating in more than 10 for whatever reason, if you'd please call it, this is the non-emergency number at the Corpus Christi Police Department. First of all, we're not interested in finding anybody, arresting anybody, doing anything like that. Our interest is your health and your safety. And so if you just call these numbers, 886-2600, they'll have the chief has said they'll send someone out and remind them of the rules, not to be gathered in groups of more than 10, and hopefully they'll understand the rules and participate. But there is some enforcement ability if someone just wants to go rogue and not do that. Well, they do have some enforcement facility, but that's not our intent. It's, again, just to give some warning. Sometimes we get excited and we'll forget that. So, and I have to pay attention, because if all my family gets together, we've got about 12 or 15 people, so I've got to be very careful if all of them are over there or they stay in a separate part, or maybe we'll have shifts coming to my house. I'm not real sure, but everything, we have to be mindful of that, because none of us want to expose our family or friends to this disease. And so we ask for that participation. We want to wish your families the best of this Easter holiday season, and it can be exciting, and hopefully shortly thereafter things will begin to turn around for our county, for our state, and for our nation, and we can get back to life as normal, or as they say, it may be the new normal following this, but we're going to prevail, and we look forward to that day. But in the meantime, please follow the rules. They're for your safety and your health, and that's really what the judge is losing a lot of sleep over. I'm losing a lot of sleep over, Peter and the rest of them that are out there working. And then again, just on behalf of all of us that you might see on a daily basis, I want to say a word of thanks to all of those that you don't see on a daily basis, and that's the doctors and the nurses and the firemen and the policemen and the paramedics and all of those out there that are working every day 24/7 to keep you safe and out of harm's way. So, Judge, if you'll come up and share with us what's on your mind, but we look forward to seeing you again, and have an enjoyable Easter in your preparations, and look forward to it.
En resumen, el Viernes Santo y la Pascua se celebran un par de semanas. Me gustaría recordarles a todos acerca de algunas opciones para celebrar este año y seguir las pautas del distanciamiento social. Puede utilizar servicios en línea como servicios religiosos o conectarse con familiares. Aún puede celebrar con la familia inmediata en casa. Lo más importante es que se quede en casa y practique el distanciamiento social para minimizar la exposición al virus. No ponga en riesgo a su familia. Nuestro objetivo es proteger la salud y la seguridad de la comunidad mientras continuamos disfrutando de la Pascua. Y si ve a un grupo numeroso de más de 10 personas, se le pide reportarlo al Departamento de la Policía en número de no emergencia al 886-2600.
Thank you. So here we are again at our 5 p.m. briefing, and I think we learn something every single day. Today I was joined by so many Texans that we had the opportunity to watch our governor give extension of orders that will extend till April 30th. In addition, over the weekend, we saw our president also give the same extension to April 30th for essential services and guidelines for our social distancing and all of the other good practices that we've learned. It is very clear that we are learning to adapt to our new order, our new society, even if it's going to be for a short time. And I've been working over the past 24 hours with Nueces County commissioners and, of course, always our city partners, Mayor McComb, Manager Zanoni, and so many others, to make certain that we are keeping everybody up to date as new developments occur. In particularly, I've been very focused on our business community, working with other county judges from South Texas and also our coastal bend. And it's very clear that we are all experiencing the frustration and the economic impact of stay-at-home orders throughout the entire region. And it seems that although it can be devastating and disruptive to our local businesses, and particularly our small businesses, I can tell you that the resolve amongst all elected leaders and all our partners is to do everything we can to build a coalition to get our folks back on their feet as soon as possible. I also want to make certain that everyone understands that I do not want to, as your county judge, have a stay-at-home order any longer than is necessary. But I also do not want to prematurely declare any victory before this terrible disease is defeated. So I know that the mayor and I and Manager Zanoni and the whole staff will work very closely together to make sure that our orders are aligned so that we can be as consistent as possible across Nueces County to meet the goals set out by our president and by our governor. At this moment, I don't have a timeline for a decision. As you know, our orders last till April the 8th, but I will be working after today's press conference with our county attorney and working with our commissioners so we can get an answer to you sooner rather than later, and everyone can start planning accordingly. The one thing I'm absolutely committed to is giving clear guidance so that people can follow based on what's best for our county and our residents. I want to echo what Mayor McComb said regarding our need for everyone to comply with the letter and the spirit of the order. Our goal is to educate, not enforce. We see everybody doing the right thing every day. I told you all yesterday about our hotline, and the phones have been ringing very, I would say, frequently. But I will say that I've seen a shift in the last 10 hours. And that shift is less about questions regarding the stay-at-home orders and more about how they want others to follow the orders. And so there's been a real clear message from the citizens that they want us all to be safe. And the best way to do that is to encourage our fellow coworkers and our neighbors to make certain that we're all following these orders. You know, you don't have to be a judge to help make these orders work for all of us. You can say, hey, let's all spread out in a very friendly way. And so I am reassured, even more than ever, that when I keep getting your texts and your messages and your phone calls about where you see something not working and how you've made an effort to let them know that that is not in keeping with the spirit of the orders and really not in keeping with our own public safety, that makes me proud. And so I would like to say that our goal of educating is working. And this participation is getting close to 100%. And for those of you that are seeing things that you don't think are right, speak up. How many times have we said, if you see something, say something? The same thing applies here. And we can do it in a spirit of love and compassion and confidence that we're doing the right thing. So let's keep sending those good comments and good questions. Remember, our hotline is available in English and in Spanish. And I have access to other professional translation services. So whether it's American Sign Language or whether it's any other language, I want to be able to answer your question. Again, our number is 361-414-6000. We're open from 8 a.m. to 5 p.m. Monday through Friday on that hotline. And after hours, our email is county.attorney@nuecesco.com. I also want to tell you that I like to read and reflect upon the things that are happening daily. I love being forward thinking, but I also need to be present minded. So while we were talking about distance, and while we were talking about the importance of this season of love, I thought these words might comfort you. It hurts not having you close, but would hurt even more not having you at all. So please know that all the efforts of your electeds, from the highest elected official in our land, the President of the United States, to your governor, to those in your own backyard, including myself, it does hurt not being able to hug you, to shake your hand, to be close to you, and to be making certain that all of our small businesses are up and running. It does hurt. But what would hurt more is for us to lose any one of you. And that's why we're doing what we're doing. And so I want to thank you as we enter into this beautiful season, your spirit of cooperation and your spirit of compassion for one another. This invigorates me, inspires me, and motivates me. And I do want to echo what our governor said. Our clergy are essential. I said it earlier this week on a radio show, and I meant it. There are guidelines and ways that we can continue to receive spiritual guidance, and we will. Tomorrow, I'll be hosting a conference call with ministers and people of faith of all religions. And if you would like to participate in that call, just call our office if you're a member of the clergy. My purpose in hosting this call is simply to reinforce that message that you are essential, particularly at this very trying time that we find ourselves in. But there are guidelines that we need to follow, and those are the ones that we have repeated over and over, the rule of 10 and that of social distancing. However, there are other ways to be innovative and creative, so I look forward to being at one of your drive-through blessings this Sunday. Thank you, and thank you again for always covering these press conferences. I'm hearing from our citizens how much they are enjoying tuning in. I would think they would have gotten tired by us by now, mayor, manager, but somehow information is comforting. It is true that knowledge is power. Thank you so much.
En resumen, el gobernador extendió las órdenes hasta el 30 de abril para continuar con el distanciamiento social. Hemos tenido reuniones con otras agencias y estamos conscientes del impacto económico que esto está teniendo. Queremos que todo regrese a la normalidad lo más pronto posible. La línea de información sigue abierta al número 414-6000 de 8 de la mañana a 5 de la tarde de lunes a viernes, o puede mandar un correo electrónico a la dirección county.attorney@nuecesco.com. La mejor manera de mantenerse seguro es siguiendo las órdenes que se dieron aquí. Los residentes están cada vez más informados y se nota. Continúen mandando sus mensajes. La información la estamos dando en inglés y en español. Les quiero agradecer su compasión y eso nos motiva.
Okay. All right, thank you. I'm going to update us on our statistics for the Nueces County area. And since yesterday at 4 o'clock, the County of Nueces is confirming 3 additional persons to have the COVID-19 virus. So with 3 additional since yesterday, we had 31. That would bring our total then today to 34 total cases. In Nueces County, there are still 0 deaths relative to this virus. However, of those 34, we do have 6 individuals in the hospital, and 2 of those persons are in critical condition, and 4 are improving. So we have 6 in the hospital of the 31, 2 are in critical condition, 4 improving. The remaining 28 are at home. Most are recovering. There's 1 or 2 that are recovered, but most of those 28 are still recovering. In terms of the breakdown, the majority, 53%, are male, and 47% of the 34 impacted are female. And the age grouping still remains pretty consistent to what it has been, which is the majority fall in a 40 to 49-year-old age bracket, and then a 60 to 69-year-old age bracket. That's about 9 and 8 in each of those brackets. Our testing continues, and Annette will talk to us about that a little bit more. Yesterday, we had 154 tests done in our lab. Through today, with an additional 23 completed, we've completed 177 tests in our lab, and soon we'll have the commercial and hospital tests as well. Those 3 new cases since yesterday at 4 are all residents of the city of Corpus Christi. So that brings our total of 30 of the 34 persons with COVID are in the city limits of Corpus Christi. 1 is in the city of Robstown, and then 3 are in Port Aransas. All those are within Nueces County. And as we heard Judge Canales say, the governor today extended his social distancing and group size guidelines and actually made his a little more strict, more reflective of the stay-at-home order that we've seen here in Nueces County. And so we wanted to show you some of the guideline and order timelines again. This is updated since yesterday. So the federal level remains at April 30th, and that is mostly group sizing, social distancing recommendations from the federal government. The governor today had a press conference, and we're still, along with the judge at the county, we're reviewing with our attorneys the language and what this means and how it impacts our local ordinances and orders. And so initially, the governor had an order that was through April 3rd, which would have been this week. He extended it to April 30th for the entire state of Texas. And that does have a little more broad or stricter language about staying at home, except if you're an essential service or if you're in an essential business. There's a list of those that are available, and we'll be providing that information to our own community here so people can understand it more. But April 30th then is that stay. He also mandated that all schools in the state of Texas remain closed until May 4th, and you can see that on this chart today. So May 4th is the new closure date for all schools in Nueces County, or actually in the state, but for us here as well. Our 2 stay-at-home ordinances mirror each other, those being the counties and the cities. We've partnered both collaboratively. So Nueces County is next Wednesday, the 8th, and ours also is the 8th. Normally, the first Tuesday of the month, the city council is on recess. They don't have a council meeting. But we talked today with the city council in our council meeting where we'll probably have an emergency meeting next Tuesday to potentially consider extending the city's stay-at-home order in collaboration with the county. The county commissioners have their regularly scheduled meeting on Wednesday next week. And so between today and next Tuesday, Wednesday, the mayor and the judge and our council members in the commissioners court most likely will be dialoguing about what will we do here locally. So these dates that you see here, we'll continue to show them because they often and potentially will be updated again, at least for us here locally. Let me talk to you a little bit about first responders. We know that the community really embraces those first responders. That includes our police and firefighters. And we do as well. I know I speak on behalf of the judge and the mayor and all our city leaders that our first responders are critical in our community. We love those guys. They're led by Chief Markle in our police department and Chief Rocha. They were often reminded in instances like this how critical they are. Sheriff Hooper as well in the county. And so they have a tough job. We're a city and our organization of over 3,000 employees, but the police and fire first responders arguably have the toughest jobs. And times like this makes us mindful of that. And so we want to thank them for putting their lives on the line every day. And we're appreciative of that, and we're more reminded of it in times like this. Let me give you a status on those first responders that have been impacted because of dealing with patients or criminals that have been either tested for COVID-19 or maybe suspected to have it. So as of today, we have 15 police and firefighters in quarantine, 15. Yesterday, that number was 7. There were 7 firefighters, but 2 were released late last night or early this morning, which left that number of 5. But this morning, there was a pretty bad vehicle accident on Gullahar, and that resulted in an additional 10 first responders being placed in quarantine. The person had to be extricated from their vehicle, and there was some blood involved. The vehicle had to be moved. So the health director, Annette, suggested that those 10 stay in quarantine until we get the results of that patient that was ultimately taken to the hospital. So that included 6 additional firefighters and 4 police officers. So with the difference between 2 being released and the the 10 being placed into quarantine. We have 15 in quarantine today. I do want to remind the public that we do care about all our employees, but especially our first responders, and we've taken steps many weeks ago to make sure they're safe when they go out to scenes today. And this is important for the general public to be aware of. If you call an EMS first responder, things will look a little bit different than what they did a few months ago or a few weeks ago. And so today, a city of Corpus Christi first responder, a fire paramedic, when they go to the scene or say to your house, what you're going to see is fewer vehicles. You may have in the past seen a fire truck and an ambulance unit. Today, you'll probably just see one vehicle to start, and that is to keep fewer persons in exposure situations. So we'll make sure we always have enough employees to get out there and help our community. Another thing you'll see different is that only one person may go into the house. One firefighter, paramedic may go into the house. The other one or the other additional will wait outside until they have a better situation, a better handle of the situation inside the house. If the person's expected to be a COVID person, then they're going to come in with more gear and more precautions. So one paramedic, firefighter will enter into the premise today, whereas in the past you may have seen 2 or 6 going all at one time. Our firefighters and police officers are wearing the appropriate protective gear that is suggested by the CDC and confirmed by our local health director here. And so for firefighters, that includes goggles. They'll have goggles on. They can have a face mask, the strongest kind, the M95s they call them. They'll have gloves on their hands. A firefighter may have a complete protective shield over their face, a plastic protective shield, and in some cases they may have a whole gown on. So not to be bothered by that, it just protects them and ultimately protects you to make sure we have enough first responders to help in these situations. And I believe that is it for my part of today's presentation. So with that, we're going to turn it over to our Metro Health Director, Annette Rodriguez.
En resumen, las estadísticas. Hoy hay 3 pacientes adicionales en comparación al día de ayer, haciendo un total de 34. Afortunadamente no se han reportado muertes. 6 de ellos se encuentran en el hospital, 3 en condición crítica. 28 se encuentran en su casa recuperándose. La mayoría son varones de 40 a 49 años de edad en rango. Pronto vamos a tener resultados de laboratorios privados. En cuanto al mandato presidencial, continúa el distanciamiento social hasta el 30 de abril, el mandato estatal el 30 de abril, en el condado de Nueces el 8 de abril, en la ciudad de Corpus Christi el 8 de abril, para los distritos escolares hasta el 4 de mayo. Estas fechas pueden cambiar. También ha habido cambios en el Departamento de Bomberos en la forma en que están operando diariamente para evitar que sus elementos de emergencia contraigan el virus. 15 bomberos se encuentran bajo cuarentena y 4 policías se encuentran bajo cuarentena.
I'd like to give some updates for public health. We're going to continue to have our drive-thrus. I'd also like to remind the community these drive-thrus are by appointment only. If you're sick and you believe you have the coronavirus, you can call the health district at 361-826-7200 for a pre-screening assessment. The health district is also trying to provide comprehensive data on the total number of COVID-19 tests that are conducted locally. We have reached out to other health departments in our region. We found a really nice app which is utilized by local hospitals and physicians that can be used to report the number of COVID-19 tests conducted in Nueces County on a daily basis. This information will give us a total number of COVID-19 lab tests that are being conducted for both private and public labs. The health district is also working closely on a project with the blood bank on a very promising technique to fight the COVID-19 disease. This goal is to start a convalescent serum program here locally. Convalescent serum is where you take blood from a recovered COVID-19 patient, process the blood to isolate the serum, and when completed, the serum, which contains antibodies, can be used on critically ill COVID-19 patients. Antibodies are produced naturally by the body to fight off infections. Recovered patients produce the antibodies while fighting off the disease. The antibodies that recovered patients produce can be used to slow down the symptoms and aid in recovery until medication or a vaccine can be developed. This is an emergency authorized technique that's allowed by the FDA during this pandemic to fight the COVID-19 disease. We are continuing to advise the general public to stay at home as much as possible. When you do go out, do not congregate. Avoid being around sick people and practice social distancing of at least 6 feet. Vulnerable populations such as the elderly, pregnant women, and individuals with comorbidities or immunocompromised individuals need to shelter themselves from the rest of the population. This includes immunocompromised children. Family members, friends, and neighbors need to check on these vulnerable populations by phone, Skype, or other means to make sure they have what they need: food, eggs, milk, toiletries, medication, vegetables, etc. Please do your part and stay home, stay well, and stay informed. I will now turn it back over to Mr. Zanoni.
En resumen, le quiero recordar a la comunidad que las pruebas móviles se realizan solamente a personas con cita previa. Si cree tener el virus, llame a la línea directa del Distrito de Salud al 361-826-7200 para que se le lleve a cabo una evaluación telefónica. Si le niegan la prueba después de su evaluación, puede comunicarse con su médico de atención primaria para que le realicen una prueba en un laboratorio privado. Para entregar mejores resultados, estamos trabajando en una aplicación que permite a los hospitales y médicos locales informar el número de pruebas por el virus realizadas diariamente. Además, el Distrito de Salud está trabajando con el banco de sangre en una técnica muy prometedora para combatir el COVID-19. El objetivo es comenzar un programa de suero convaleciente aquí localmente, donde se extrae sangre de un paciente recuperado del COVID-19, se procesa la sangre para aislarlo y cuando se completa, el suero que contiene anticuerpos se puede usar en pacientes con COVID-19 gravemente enfermos. Los pacientes recuperados produjeron estos anticuerpos mientras combatían la enfermedad y se pueden usar para disminuir los síntomas y ayudar en la recuperación hasta que se puedan desarrollar medicamentos o vacunas. Esta es una técnica utilizada de emergencia permitida por la FDA durante la pandemia para combatir la enfermedad COVID-19. Continúe practicando el distanciamiento social.
Okay, thank you. Just one final comment, which is earlier this week, which was yesterday, Judge Canales, myself, and the mayor began a conversation in earnest on assisting small businesses through this crisis in our local community here. So over the coming days, we'll have more information for the community. This is a good platform to get information out to our small businesses and small business families. We're looking at how we can quickly put into place countywide, and actually the judge is working on a multiple county strategy for the entire coastal bend, and the city will focus on the city of Corpus Christi. But we want the small businesses to know we're working feverishly to help them. We know that this is having a tremendous impact on their business, the COVID-19 in particular, and that help is on the way, and we'll be announcing that in numerous forums, but to include here in the coming days. So with that, that concludes our press briefing for today. Tomorrow around 4:30, we'll release any updated statistics, and as well, we'll be back here at 5 o'clock for another press update. And with that, we can take any questions there may be.
So with the essential workers, are there any are you guys working with, sorry, thank you. Are you working with businesses to let them know if they're essential or not?
Yes, we are. Our website, nuecesco.com, is an excellent resource for businesses to go and see the complete list. The Department of Homeland Security really does a great job as well of giving us a list, and we've incorporated those in there. But I also encourage businesses to really use that common sense practicum, which is if you're a service that is essential to an essential service that's listed, you too are deemed part of the exemption. And so I think it's really important that if you have a question to use that hotline 414-6000 if you're unsure. But I think our website is a good place to begin. And again, it's not just about manufacturing and energy. Of course, there's healthcare worker exemptions. There's specific retail exemptions like grocers and warehouses and public storage and big box and et cetera. And then there's some that you may not think about that are essential, businesses that are associated with helping the economically disadvantaged. So you might be a 501c3 charity and maybe your business is essential. Or maybe you're a printer doing work for a government service. Government services are exempted. So I feel like every day I wake up and I go to bed answering business questions, and it's because people really want to do it right. And so I feel like that is one of the ways that Nueces County is helping. And I would encourage everybody to continue to ask those questions, because if you are part of that essential framework, we want you to work as long as you can work safely. Again, everybody should be following social distancing and the rule of 10.
With the with the fire department now wearing PPE when they respond to medic calls, does the department have enough resources, PPE resources, in the city trying to do anything to procure more?
Right, yeah. Unfortunately, the answer is no. So that's nationally, or if not internationally. But we have enough for today and tomorrow and the next several days. One thing we're doing is reusing what we can reuse. And so the N95 masks, while they're disposable, we can use them a few times before we discard them nowadays. Our goggles are more permanent. They're sanitized after each use. One thing we do have, because both this county and the city have put our EOCs, our Emergency Operations Center, have activated them. We have access to national and statewide resources, and so we're putting requests in when our supplies run low, and that includes for our lab as well. So as an example, today we got some lab materials that we need to conduct tests, and that was through the statewide request system. So that system has been helpful in the past when we've had other natural disasters like hurricanes, and we have confidence in it. But we have to be mindful that nationally materials are short. But we're doing things here to try to stretch them as far as we can, but at the same time keeping our folks safe.
I'd just like to also extend that to the rural areas and the unincorporated. One of the things that we do every Monday, Wednesday, and Friday at my office is we have a conference call at 9 a.m. with these smaller towns, whether it's a mayor or a superintendent of schools, whoever is the de facto person in charge of that jurisdiction. We get on and we talk resources. And so it's not just important to have our first responders have the appropriate PPE in the incorporated areas, but also in the unincorporated. As we travel through, our county roads and our highways, you'll often find that it's your unincorporated jurisdictions that are also attending to first responding calls. So this week in particularly, we actually hand delivered all kinds of equipment. And sometimes it was just 5 masks. And I would say, I'm sorry, it's just 5. And they would say, that's great for today. And so everybody is on the same protocol of get us what you can, knowing that we're all exerting extreme patience looking for the materials that we need. So it's not just inner city first responders, but I want you to know it's a priority for me to make sure that Agua Dulce and Banquetti and Bishop and Driscoll and Petronila and Port A, that everybody has this type of equipment, because we're all in the same boat.
Okay, do we have any other questions? Yep. Okay.
Explain what person-to-person contact is, because I know some
Person to
people.
person, that means somebody you know. So husband unknowingly could have the virus, goes home and is with the wife or children, and the husband ends up giving the virus to the wife. That's an example. A community spread case is where you don't know the person. You're at a grocery store, and somebody next to you checking out has the virus. You don't know them. They don't know they have the virus, but you contract it from them. So that's the difference between the two. Any other questions? Ma'am? Okay. Okay, great. Well, thank you again, everybody, and we'll see you all at 5 o'clock tomorrow.